Assalamu alaikum, the communication day. First scenario, Mr. David, 65 years old. He has TIA, transient ischemic attack, and he is on warfarin 6 years ago. Diagnosed as AF, atrial fibrillation. INR was stable. Recently, he developed low blood count as evidenced by blood investigation and iron study, and received iron after that. His condition improves. We did colonoscopy with biopsy. It showed that he has colon cancer. Further workup was done and confirmed that this cancer affects the colon with no metastasis. Our team decided for surgical procedure. Please sit with him, tell him regarding his new diagnosis and the plan of management. Okay, you can start now, Dr. Ayla.
Okay, thank you. Hello.
Yeah, but please, your sound is a little bit far away. If you can be closer.
Just a second. I think it's because of the.
No worry. We're waiting for you.
Is it better now?
The same, it's not clear.
Okay, just a second. Is it better? Is it better?
It's not that much clear as before. I think you are using a speaker.
Okay, is it better now? I think I have
Yes,
to remove
this
it.
is way better now. Okay, here you go.
Okay, just a second. I think I need to put this in speak like as well.
No worry. We're waiting for you.
Yep, good. Hello.
Hello.
Hi, my name is Dr. Ayola. I'm one of the doctors looking after you. Can I confirm your sorry, let's start again. Hello, Mr. David. I'm Dr. Ayola, one of the doctors looking after you. All right. Are you able to confirm your age, please?
Yes, doctor. 65 years.
65. Okay. All right. Thank you for coming today. I want to have a conversation with you about an update about your health. Is it okay we have this conversation today?
Yes, okay, doctor.
All right,
You can
good.
continue.
Yeah, and are you all right to have it here? I mean, now.
Okay.
Okay. Do you want anyone to be with you during this conversation?
Thank you, doctor. No.
No, okay, okay, good. How are you feeling since the blood transfusion and every other thing? How do you feel today?
Yes, doctor. Actually, I didn't receive any blood transfusion, doctor. Just took tablets, iron. Yeah. And now my condition get improved, doctor.
Oh, I'm so sorry about that. Okay, that's an error on my part. I'm so sorry. I understand you have an iron tablet. I'm so sorry about that. Okay, good. So I have an hobby. You know, you've done some other tests, some after the old iron tablets and every other thing. We've done a camera test. So I just want to update you about
Yes,
this
doctor, please.
test. Okay,
Yes,
is that okay?
doctor, please. I'm waiting here to, yes.
All right,
Tell
good.
me regarding the result.
Good. So before we proceed, let me just check your understanding about what's been going on so far.
Yes, I'm fine, doctor.
All right, good. Okay, all right. So after you you have the low blood and then we give you the iron tablets, I'm happy to know that you've improved. So we did a camera test, which is usually what we do in people of your age that have this low iron level, and then we take some sample to have a look at it under the microscope. Okay, Mr. David, unfortunately, we have the result back, and unfortunately, it is not a good one, Mr. David.
Doctor, what do you mean by that, doctor?
Okay, what I mean is that when the result came back, it shows that you are having a cancer in your gut, which is a colon cancer, basically a cancer in the gut of the gut.
Oh, doctor, you mean that I have a cancer?
Unfortunately, yes, Mr. David.
Are you sure about it, doctor? This is my result.
Yeah, from all indications, this is your results, Mr. David. I know this is a quite difficult news to give to you today, and I'm sorry that we're having this conversation, but this is what it is, Mr. David. I'm so sorry.
Actually, doctor, I'm very sad from this news, doctor, and I very shocked.
I'm so sorry.
Yes, your target now crying.
It's quite overwhelming. I
crying.
know. Giving you tissue. If you don't mind, you could take this water. Mr. David, I'm so sorry that we are having this. I'm so sorry. It's quite an overwhelming.
Thank you, doctor.
I'm so sorry. Well, usually on further assessment of this cancer, I mean the further testing to see, usually when we see cancer, we want to check if it has spread beyond where its primary is, which is the gut in your own case. We usually look out for that. And the good news is that this cancer have not spread beyond the colon, which is something which are just spread beyond the colon, and this has informed
Mhm.
the decision of how to treat you further. Are you all right to have this conversation now, Mr. David?
Okay, doctor, no problem. Yeah, you
Okay,
can
all right,
continue.
all right, thank you. So the team have met, we've discussed about this, and it has been agreed that you are you are going to have a surgical procedure. That's an operation to remove this cancer from you since it has not spread. Okay. And it's going to be a surgical procedure. Do you want us to to discuss this further?
Doctor, you mean that you need to do for me surgery, doctor?
Oh yes, doctor. Yes, Mr. David.
Oh, no, doctor, I will never do it, doctor. I am not agree regarding this.
Yeah, what? What did you say?
Yes,
I didn't get the last thing you mentioned.
I will never do it, doctor. I am not agree for this procedure. Don't
Yeah,
for me.
yeah, Mr. David. A lot of person usually initially feel the way you feel, having to know about diagnosis of cancer and having to tell them about surgery. It's usually normal to feel this way, but in your own, but this surgery is what that we need to do because the cancer has not spread and is technically curable. Okay, so we can remove this cancer from if we do the surgery and remove this cancer now, we will prevent it spreading from all to other part of your body. And if this is not done, the cancer can continue to spread to other part of your body, and this can worsen your health. That is why we think that surgery will be in the best interest to do at this time. Are you with me, Mr. David? What do you think
Yes,
about
doctor.
this?
Yes, doctor. Thank you for explain for me, doctor. But also, doctor, I didn't want to do for me this surgery.
Well, Mr. David, it's quite, like I said, it's quite understandable that you may think that you don't want to do so. But may I know why you don't want to do this surgery?
Yes, doctor. Actually, my grandmother, before she was did same surgery, and she's die. She was die after this surgery, doctor.
Oh,
So I'm afraid to do for me this surgery, and I have like my grandmother, doctor.
I'm so sorry, Mr. David, about your grandmother. I accept my condolence about this. But concerning your grandmother, I'm not quite sure what happened at that time and what was the reason for the cancer and how about the surgery, how it has spread. But in your own case, the cancer has not spread and is in your best interest to have the surgery done
Mhm.
at this time. But not to worry, we would monitor you closely. We would observe. This surgery is done by experts, people who have done a couple of it. Okay, we'll monitor
Mhm.
you closely. We will give you some pain, and we would give you something to manage your pain closely. Also, as much as we can, we would give you the most support that is required during this procedure. What do you think about it?
2 minutes left.
Okay, doctor. So I'm trying to think regarding this. Yes.
Yeah, you don't have to make a decision today, okay? We can come back to have this conversation, and I'll be leaving you with a leaflet that talks about the surgery, things to expect, and specialist nurses will want to speak with you. Is that all right?
Okay, doctor. So, doctor, could you please explain for me how this should be done?
Okay, because you are on. Well, I also look at your record. You are also on blood thinners. Okay,
Mm-hmm.
you're also on blood thinners, so this might impact your surgery. So we might need to talk about you stopping the procedure, stopping this painkiller few days. I'm not quite sure how long this will be. Few days before the procedure, and also few days after the procedure. We will tell you when to recommence, and also we will discuss this with the blood doctors. We will further have a conversation with you. The procedure is quite safe and is done by experts. Every of this information is in this leaflet that I'm going to give to you. They are done by
Mm-hmm.
experts, and the risks of we'll monitor you closely. We would take over, give you some painkiller, analgesic. I mean,
Mm-hmm.
anesthetics. What I mean by that is you might likely sleep during this procedure, or and of course, there's no procedure without its own side effects, but it's not quite common. Infection, bleeding, okay? But we will look after you so well during this procedure. Are you with me, Mr. David?
Yes, doctor. Yes.
After the procedure, we'll monitor you as well in the recovery room. So when you
Mhm.
before we let you, but the nurses will monitor you before we let you off. Are you with me?
Yes, doctor.
Do
Yeah.
you have any question at this time?
No, thank you.
Okay, all right. So we'll meet again to have this conversation once you are able to make up your mind on this discussion. But you have if you want to ring us, I'll give you the contact of the specialist nurses, which you can contact them and have a conversation about this. Okay.
Mm-hmm. Okay.
All right. Thank you but may I ask, Mr. David, do you smoke?
Yes, doctor.
Okay, and have you ever considered to stop smoking?
Mm-hmm. Okay.
All right, we'll advise you if you want to stop smoking, because this can impact on your health, and because of this cancer that you've been diagnosed, it can cause it to spread. To impact on this cancer. Are you with me?
Yes, doctor.
What about alcohol?
No.
Okay, who do you live with, Mr. David?
Yes, with my family, doctor.
Okay, and will you be needing any support during this surgery and every other thing? Do you think you'll be needing support?
Thank you, doctor. Thank you.
Okay, thank you for speaking with me. Yep. All right.
Okay, if 1 minute or one question will be added, what the question will be?
Would be okay. I would want to ask about maybe support that have been during the surgery.
Yeah, you offer support, but
Okay,
you
is
ask him
job,
about, yeah,
is job,
exactly. It is
is
very
job,
important. Yes.
is job.
Okay. Yeah, I added 2 minutes for the support and the social history.
Mm.
And I guess you know where was the defect and why the time was not enough to cover all the things. I will comment after Dr. Sarah comments. Please, Dr. Sarah,
Yes.
you can start.
Okay. Yes, she did well, but she repeated the introductions and feedback of the patients, and this take for more time. And yes, regarding the breaking bad news, she did well. Yes, regarding the surgery, she did explain how this surgery and try to convince the patients. Just we need explanation more regarding the procedure, and we need to remove. We can draw in these situations. We can draw this is the area of overgrowth or cancer or mass affect your colon, and we need to remove it out, and we can connect your colon or your bowel with the back from outside, And yes, and after that we can teach you the nurse how you can deal with this bag. Yes, the complications you did it, and also the blood thinner medications that the patient he's using. We need to stop it, and we need to replace with another suitable one. Regarding the consent is the most important for these patients because he agreed to do this surgery. And yes, also we need also we can offer surgical. Yes, the surgeon. We can discuss with you more regarding this procedure, and we can sit with you to explain to you more. And also the MDT group you miss in this. We need like yes, a cancer doctor, Macmillan nurse, and blood doctor, and the heart doctor, and yes, MDT. Okay. Apart from that, yes, you offer social support for these patients. Mm, apart from that, I didn't have any comments.
Okay, thank you, Dr. Sarah, for the scenario and for the comment as well. My comment, Dr. Aoyola, I think you read the scenario wrongly. That's why you have a mistake earlier about the blood transfusion. Yes, you cover it and you corrected it immediately by apologize and saying sorry. It's good to do that. However, you have to focus while reading the scenario. And I think this also took some seconds. That's why you didn't have the time to address and to explain the procedure. The second mistake, the first time she asked you, or she told you, or he told you, I don't want this surgery. From the first moment, ask him, I appreciate worry. May I know why? Okay. Don't try to convince unless you hear the concern. Why? Because he will tell you something in his mind different and far away from the point you want to talk about. And you will spend a lot of time to convince while he has some concern in his mind. If you will not address it, he will not accept the surgery. Whatever you will say, whatever you will convince, he will not accept it, right? So the best way, whenever the patient telling you, doctor, I don't want this, I don't want to take this medication, I don't like to start, ask him why. The first concern in this point would be one of the concerns, and you can convince him immediately after addressing this concern. But if you start to explain, telling a lot of things, ideas, he will still insist about one point in his mind, which is in this scenario, I had a family member which he died or she died after having the surgery. Now you can say there is difference maybe between you and him or her. There is possibility to be another cancer, or in your stage, it might be different than the stage of your cousin or your grandmother, or the age is different as well. You can convince by any way using these sentences, right? Because you don't know what happened with his or her grandfather or grandmother. And please, whenever you hear about someone in a family member or in a family which is lost due to a cancer or due to a disease related to the patient, and he thinking it might be related to him, please be sorry and ask about him. If he's lost, I'm sorry for your loss. My condolences to you and your family. And if he's fine, okay, good to hear that he's fine. And reassure him he will be fine as well as his grandmother or grandfather. This is the way how to play with the words and sentences with the syllables. Okay, this is the second point. The support, of course, you offer, and the social, the job. Don't forget always to ask about the job. It's not only a matter of social. Sometimes the job might be related to the cancer itself, and you might offer him, for example, mesothelioma and compensation in the previous scenario. In our scenario, maybe or maybe not related to the job, but you have to ask it why in two ways, either to give him the support and to feel that he's already working and he has his own support. The other thing, if it's related to something exposed, occupational, or any job related to the cancer, you might offer him the compensation. For example, some bladder cancer, and I think it's related to aniline dye exposure, right? Industry. You might also offer him compensation, bladder cancer. So always remember the job in two parts, either to support him and to know that he's already dependent on his own. The other point is to offer the compensation if it is related to the occupation. Otherwise, the introduction, yes, you did well, but you forget the age. Always try to ask yourself about the age and the name. Don't ask him what's your age or how old are you, because they are considering that you are not focusing in the data of the patient. How many data you are writing? It's not that much. Only the patient name and his age. Two names, of course, not only one name. We are using single name in the practice, but in the exam, use two names. Even if they write three, use the three and ask him how to call him while discussing this scenario. The other thing, the invitation, yes, you can invite here because it's bad news. Breaking bad news, of course, you have to do. Even the cancer is early stage, but you have to say it's a cancer, and cancer never ever will be not bad news. Even if it will be cured with surgery, but you don't know in the future, it might recur back, or it might spread without knowing from the patient or noticed. So the cancer, by any stage, I think it's bad news. No arg about that, right? So whenever you have a cancer, even early stage, you can use the break bad news. Unless you have lymphoma, for example, which is good curable cancer. This is the only scenario in PACES you can use it without breaking bad news. You have a cancer, but there is possibility to be cured totally from your body. But other than the lymphoma, particularly the Hodgkin lymphoma, all cancer will be breaking bad news. The expectation, of course, as Dr. Maida wrote, try to ask, what do you think, what's ongoing, how do you feel? All this question is okay, but try to sum up and to hurry up in the introduction, because you have a major task in this scenario, which is the procedure. Colostomy, it's hidden agenda. Really, it's not expected to explain it. At least draw the colon and the mass inside a simple figure, and we will try to remove this. If you remember the colostomy, which is major part of the surgery, it's okay. If you don't remember it, you might forget it, because no, you are not surgeon to remember if this patient will have colostomy after or no. They might remove and they do reanastomosis, the section anastomosis. I don't think it's something necessary to be done. Some surgeons, they prefer to do the colostomy. The others, they don't prefer. We are not surgeon to discuss this issue, and I don't think they can judge on you about this part of the surgery. So the most important, the resection. But if you add colostomy, yes, you can add it, because I think this is the hidden agenda in this scenario, and they want you to educate the patient how to deal with the colostomy bag. The specialized nurse will be educating you how to do, how to clean, how to change, how to do dressing, how to observe. I think this is the main task, because the surgery is nothing. You will remove the cancer, and what else? I think the colostomy here is important to put, but they should put it in the task. Please, the patient will have cancer resection plus colostomy. So you can talk about colostomy, but if they will not write, I think difficult to remember the colostomy as a part of the surgery. Anyway, I hope this scenario will remind everyone, if he faced this scenario in the exam, to remember the colostomy part of the surgery. Okay, any point or suggestion, Dr. Ayula or Dr. Sarah?
From me now.
Okay, Dr. Ayula, any question? Okay, I think clear. Dr. Maida comments. You want to comment, Dr. Maida? I read the comments. We need.
Oh, sorry, I've been muted. Sorry, I've been talking to
No
myself.
worries. It's okay.
Okay, so I was just thinking about this scenario.
Yeah.
Okay, because all of the because I was just being reserved in terms of explaining the procedure further because I wasn't too sure of the procedure. I know it's of course it's coloscopy, but as it's generally known about communication that what is not written, you don't tell it, you don't inform the patient about it. So for this question it was not really included. So I was just thinking in my mind that those are just the area that I was not quite sure what surgical procedure that it wants to do for this. So my question now is, fine, we know
Yeah.
that.
Yeah, I agree with you. It's supposed to be written as option. What the option should be written in the possible surgery. What are the possible surgery steps? They should give us either colostomy, colectomy. We don't know. Ileostomy. They should write what the main surgery will be done for this patient. I don't think they will just write explain the surgery. I'm not surgeon to guess how the surgery will be done, right? That's why I said it's hidden, but I think it would be clear in the exam as a task. Explain the colostomy because the colostomy care maybe it's for the long term will be with the medicine and the education nurse how to deal and how to educate. But if it will be like this, I think all of the candidates might fail the station because no one will know what is the step or the proper or accurate surgery will be done. Agree, Dr. Ayula, right? I agree with you, by the way. You have other question, Dr. Ayula?
No, I'm fine, thank you.
Yeah, most welcome. And otherwise, well done as usual. Okay, any question from others before moving to the next scenario? Okay, we need team here to manage the patient. Of course, always remember the MDT, but don't say MDT. Or if you will say MDT, multidisciplinary team, you can explain it. They are a group of specialists, which are specialized, experts, professional, experienced. They are doing this surgery many, many times. Explore the patient expectation exactly and the concern before giving bad news. Agree. First, ask patient if need someone. Yeah, she did, I think, Dr. Maida. Okay, Dr. Sarah, your scenario. You are saying 45 years old, patient has recently been diagnosed with non-Hodgkin lymphoma. The hematology team has requested a Hickman line insertion to facilitate chemotherapy. The patient has been referred to you to discuss the procedure, its purpose, and potential risk. Your task is to explain what the Hickman line is and why it is needed, address the patient concern regarding the procedure, provide reassurance, and obtain informed agreement for the procedure if appropriate. I think this is a clear scenario with a clear task. Suppose the exam will be like this, not as the previous scenario. Someone asked the previous scenario to be shared. I will share it. Now you can see it, Dr. H.A.
Okay, the name of patient in our scenario.
John
Maybe
Smith.
it's John Smith. Okay. If you're ready,
What?
Dr. Sarah, let me know.
John Smith is
John
right.
Smith. John Smith.
Okay, John Smith. Okay.
Ready?
Yes. Okay.
Okay. Here you go.
Hello,
Hi, hello.
I'm Dr. Audrey Karim. I'm one of the doctor covering the blood clinic today. May I confirm that you are John Smith, 45 years old?
Oh yes, that's me, doctor.
Yes, actually, we are here to talk regarding your health condition. Is that okay with you?
Yeah, sure.
Okay. So before I proceed further in our discussion today, could you tell me how much you know regarding your health condition?
All right, doctor. I've been recently I've been told I have a form of cancer. I think it's
Mm-hmm.
non-Hodgkin lymphoma. I think, yeah. After
Mm-hmm.
my I've been with some of those symptoms, and I've been asked I've been told I'll be needing chemotherapy. and then I'm also aware that I'll be needing some tube insertion into my body to allow
Mm-hmm.
the chemotherapy. So yeah, I'm here today to discuss about that, as far as I'm aware of.
Okay. So thank you for sharing this information with me, and I'm sorry for suffering, Mr. Smith.
Mm.
Mr. Smith, before I will explain to you regarding this procedure, do you want from me to explain to you more regarding your Hodgkin lymphoma?
No, doctor, no, I don't think so. I think they've had a conversation with me with the blood
Okay,
doctors. I quite
fine.
understand it.
Okay, fine. So, Mr. Smith, actually, our team, they decided to give you the chemotherapy, which is the medication that to kill the cancer cells and to recover your condition and to treat it. If you are received this full course of these medications, and we need to give you through the to insert a line which is like thin tube, which is called catheter, which is called Hickman line. Okay.
Okay,
So,
perfect.
yes, have you ever heard about Hickman line before?
No, no.
Okay. So this is the most important now to give you and to provide access to the large blood vessels and to give you these medications. And also the aim of this and the importance for that to avoid to break your skin and to damage your skin every time when you are trying to give you these medications in each course. So that is why we need to do for you this procedure. And also, I would like to assure you that this procedure will be done by expertise team who did such a procedure before at many times. And yes, so are you following me?
Yes, I'm following you, doctor, but just
Okay,
I'm not quite
so
clear about
yeah,
where will you put the Hickman line? Is it in my head? Is it in my leg? I just can't really.
yeah. Yeah, your concern is valid. I have appreciated it. Yes, just please follow me. I will try to draw for you to make it simple to understand it. Yes, this Hickman line, Mr. Smith, it is like thin tube, long, should be inserted in the large blood vessels here in your neck. Okay, and
Mm.
before we do this, before we insert this tube, we need first to clean your skin, and we can give you number medications to keep you free from any pain. And after that, we will introduce this thin tube through the large blood vessels here in your neck. Okay, and after that should be fixed in your upper chest. Um, and also during this procedure, it like any procedure, it has some bad effects or complications that it might be happen, like pain, injury, sometimes infections, but don't worry regarding this, as this will be done by expertise hand, and also after that we can keep you in the yes here to follow your conditions, and if you are develop any kind of complications, we can deal with it appropriately. Are you following me?
Oh, yes, doctor. But to
And
be
to this
honest,
point, you are understand me?
yeah, well, doctor, I quite understand you that I'll have a tube in my neck. But to be
Okay.
honest, I'm still trying to take in the fact that I have cancer, which is quite overwhelming for me. And now I need to go around with, a sort of tube in my neck. That is so, I don't know, it's so terrible for me, terrifying for me, really. This will constantly remind me that I have cancer. And I'm quite worried about this.
I'm sorry for that. I understand your reaction and your worries. I know this is how much it's hard for you, but as you know that this is important, and to insert this tube now and to give you to provide access to give you to receive these medications to kill the cancer cells, and also we can cover it. under the clothes, and we can involve also. We will refer you to nurse here. They can teach you how you can deal about it, Mr. Smith. Is that
Okay.
okay with you?
Yeah, okay, but doctor, do I really need to go around? Do I really need this?
What?
Do I really need it?
I'm not hear you
I
well.
mean, do I really need to have this line?
Yes, yes, Mr. Smith. Yes, this line it is most important for you, for your health.
Okay. All right, if you say so.
Okay.
Mm,
Okay. So,
okay.
okay. So, Mr. Smith, what do you think regarding to do for you this procedure and to
Yeah.
insert this line?
Well, I'm not quite sure I'm ready to have this, to go ahead with this right now. There's a lot. This is a lot for me to take in right now. I must confess to you because I don't know. I don't just know how this will affect me. My activity, my showering, going to bed, having to have something in my neck. Oh gosh.
Um, I'm sorry for that, Mr. Smith. Mr. Smith, actually, are you aware regarding if you are not take these medications, what happened regarding your condition and you have this cancer in the blood cells? Now it can be spread if you are not take these medications and this time, and your condition can be difficult to treat even, and can be life threatening.
It's okay. I'm quite aware of that,
So,
doctor.
what do you think regarding this, Mr. Smith?
Well, I'll just have
Are
to
you willing?
I'll just have to think about this.
Okay. So,
But
Mr.
doctor, if I
Mr.
don't want
Smith,
to go ahead with this, is there any other thing that you can do for me?
what
Do I have options?
other options you mean,
Mhm.
Mr. Smith? They decided to do for you in
Two
the best
minutes left.
interest of your conditions, and to provide access and to the large blood vessels. And if you give this cycle in your small blood vessels in your hands, like it can be more harmful and to your skin, and also it can be more painful, and it can suffer more if you give this and if you receive this medication through these small vessels,
Okay.
because this medication is very toxic and it can damage your blood vessels. So that
Oh,
is why we need access to the large blood vessels, Mr. Smith.
I'll see. I'll see. Okay.
Yeah.
Okay. Yeah. Thank you,
So
doctor.
yeah, okay. So now you are willing and you are agree to do this for
Yeah.
you.
Yeah. Yes. Yes, doctor.
Okay, all right. Mr. Smith, we need from you to sign a consent, which they involve all of information that now we discuss, and the benefits to do for you this procedure. And yes, and if you are change your mind at any time, you have right to withdraw. Is that
Mm,
okay?
Yeah. 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 Thank you for that, doctor.
Okay, so Mr. Smith, after that, we need to keep you in group of specialists, which include the blood doctor and the cancer doctor and the Macmillan nurse. All of them, they will take care with you for you and will
Mm,
provide you with suitable treatment and care. Is that
mm.
okay with you?
Yeah, doctor. That's it. Thank
So,
you.
do you have another concern for me?
No, no, I'm good.
Okay, may
You've
I
been
ask you?
helpful today.
Okay, may I ask you what you are doing for living?
I'm a teacher.
Okay, so how much your condition impact your job and usual daily activity?
Well, just the tiredness, and I've informed my employer about this, so they are quite
Mhm.
supportive and aware of this.
I'm sorry for that. We can provide you with reporting letter to your job. And also, at any time, if you are need any kind of help, like social, I'm happy to help you regarding this. And yes, may I know with whom you are living?
I live with my family, and yeah,
Mhm.
we are doing quite well.
Okay, anyone of your family depending on you, or you are need any kind of help from us or support?
No, for now,
Okay. So, Mr. Smith, do you smoke?
No, I don't.
Do you drink alcohol?
No, I don't.
Okay, so Mr. Smith, yes, we will provide you with some brochures and trusted website to read more regarding the importance to do this procedure and to insert this Hickman line for you and to receive these medications as soon as possible. And also, we will involve you with with supporting group and when who sharing their experience with you. And this is the contact number for our department. Please don't hesitate to ask us if you have any worries or any queries. Is that okay?
Okay, doctor. Thank you.
Okay, time's
Okay,
up. I
thank you.
added 1 minute to finish the all concerns. Any question or concern extra you want to ask?
Okay.
The
You
job
have
again.
another concern? Do you have
The-
any concern for me other?
You
Is
ask
that,
about the job, Dr. Sarah?
Yes, I'm asking, yeah.
Okay.
Also, yes, also we need to provide, yes, before doing this procedure, we need to check your blood. We need to do further blood tests to make sure that you are suitable to do for you this and to insert this line for you.
Mhm.
Is that okay?
Yeah, it's okay, doctor. Thank you.
Okay,
Okay.
fine. Thank you.
Okay. Thank you, Dr. Sarah. Well done. Let's hear Dr. I recommend and I will comment.
Yeah, well done, Dr. Sarah. It was a good presentation, a good interaction with the patient. I like the fact that you really offered to explain more about the lymphoma, which is quite good. But one thing I would say at that point is that maybe you could also ask, like, okay, do you want me to explain more about the lymphoma? Okay, no. So how have you? I know much about it. I've been told. So how have you been feeling with the thought of having to go through chemotherapy? Just to show how connected and supportive you are ready to have with this patient. I like the way you explain the whole process, how it's been done, and every other thing. You also discuss about the side effect, but there are some side effects that should not be missed in complication. I mean, in big line Hickman line insertion, which include pneumothorax, though it's quite rare, but patient needs to know that there are risks of it and the risk of blockage or displacement. And they need that they'll be requiring them to do a chest x-ray after the procedure so that we can know if it is well inserted or not. But just that it's quite rare, just to support them more again. Then for any procedure, um, you should always mention one or two option alternative, especially if patient has raised it like I did. Patient have raised that if I don't have this procedure, do I have options? You should just raise one or two and tell them why this current one is being preferred. This for this patient now they have options of using the peripheral line which you discussed because they can have bone. They also have options of PICC line, peripheral insertion of catheter line into the also peripheral line, but to the larger vessel of the is in the hand, but also the risk of displacement getting blocked is higher than the Hickman line, which goes straight into the larger vessel.
Blood sharing. Yeah.
Yeah, so basically that is the what I just wanted to ask. I like you offer support, which is quite good. You refer to the specialist nurses who will counsel me about the patient, I mean about the possible side effect. The other thing we need to talk about is this having an Hickman line will definitely affect, you need to acknowledge that it's going to affect this patient activity, daily activity, having to have it dangled this line on the neck. So we are sure that we will stabilize in the neck and then cancel on activity. We want to shower waterproof on covering on it. It's not likely to be able to swim again. For now, since they have the Hickman line, just ask like, what are your hobbies? If patient swim, I was just going to tell you I swim. If you have asked me for my hobby, I swim. I can tell me about. But as long as I have the Hickman line, I might not be able to swim for now, and I need to have a shower, not a bath. I can't do a bath anymore. It's just a shower that I can do for now, pending the time that the Hickman line will be in. Another thing that needs to we discussed, I didn't raise it because of the time was already against us, was the issue of when it will be removed. We just need to discuss that as well. That is going to be there as long as you're having your chemotherapy. And once there's no need for it, you are done with your chemotherapy, this will be removed because it can also put you at risk of blood clots. So yeah, basically that is it. But altogether, we did so well. Well done.
Yeah, thank you, Dr. Ayula. I think Dr. Sarah did well. Apart from the confrontation zone, whenever, again, the same advice, whenever you have a procedure and the surrogate is telling to you, no, doctor, I don't know, I don't want, I don't prefer, find me another solution. You have to know why. In this scenario, she told you about something else she had, but you didn't ask her why. Instead, you try to convince her by confronting her. If you will not take the chemotherapy, you will have spreading of your cancer and you
What,
will be
Dr.
dying.
Batem? Yes, please repeat.
Repeat. Okay.
Yes.
Instead of
Mm,
confronting the patient by telling to
mm,
her, if you will not take the chemotherapy, you might have the cancer spreading, you might
mm,
even die. Ask her
yes.
why. What's the reason behind refusing this procedure? She will tell you,
Yes.
as Dr.
Yeah,
Ayula
right.
said, yeah,
Mm,
as she said, I don't know how to take shower with it. I like or I do some hobbies. Is it
mm-hmm,
applicable to do it again? So try to address this issue instead of confronting her. This zone of convincing or the way of convincing the patient by telling about the advance of the cancer or the something will be happen if he will not take the medication, like confronting him, they don't prefer it at all. The best
mm-hmm.
way, ask her why. Always, whenever the patient, as I advise Dr. Ayul and the first scenario, now I will advise you. Any
Yes.
patient saying to you, no, doctor, I don't prefer, I don't like, tell him why. There is a concern and there is a reason. You have to give a solution for it. If you don't, she will not accept it till the end of the scenario. She will waste your
Mm-hmm,
time arguing with you, no, doctor, I don't like. No, doctor, I don't like. And you are trying to convince from other ways. No, you have to take it. It's very important for you. It's important for your condition. It's important to kill the cancer cells. But she's not caring about these things. She's thinking about something in her mind. She wants to practice her life as usual or as a normal person. However, she's not. But try to give her solution. Let's imagine the option of the shower. Will she take a shower? Yes, she can take.
yes.
But the bath she cannot take because something full of water she cannot be inside. The same
Yes.
as for the swimming. I'm so sorry. You cannot be or you are not able to be swimming while this catheter or
Mm-hmm,
this line in your chest. However, whenever it's suitable to remove it, we
mm-hmm.
will remove it and you can resume your hobbies back. It's something
Okay.
temporary, right? Definitely, it's something temporary. Whenever she
Mm-hmm,
will finish the cycles and the course of the chemotherapy, she can be removed or it can be removed.
mm-hmm, mm-hmm.
So this is the way how to convince her. She will not care
Okay.
about the cancer will be spreading or not. She will care about what she want to do with this
Mm-hmm.
line. That's why
Yes, regarding the showers and so I'm sorry, Dr. Batim.
Mhm.
I will tell him regarding, I will refer you to nursing.
Okay,
Nursing, yes.
good
They
way.
will can explain to you as how
Exactly.
you can deal with it. Uh,
Exactly. How to deal with it, how to cover it while taking
yes,
shower.
exactly. Yeah.
Yeah. And we will give you some instruction at the end. We can give you a leaflet brochure. The
Mm,
nurse will sit with you to teach you how to deal with it in different situations, going
yes.
outside, going to the work. Because some of them will tell you, how, doctor, I will go to the work with this line. It's in my chest. They might be
Mm,
seen. You will tell her, no, it can be very small dressing and it can be covered. And
mm,
sometimes under the clothes, no one will notice it. This is the way how to convince a patient about procedure or something he doesn't want it. Because it's not regular or ordinary that patient will have dressing in his chest and will go outside, right? They don't want to feel someone is can notice the thing in his body.
Mm-hmm.
They want to be covered. No one knows about their disease or their management. That's why
Mm-hmm.
you have to convince by their own mind, not by your mind. You will explain and you will draw to show her how it will be done. But how to convince? You have to convince by
Herself.
her exactly her own concerns. If
Mm-hmm.
she had something you have to convince, do it. If she doesn't, proceed. Give her the consent. You can read about it. And if you change your mind anytime, please let us know. You can withdraw and so on. But she will
Mm-hmm.
give you, believe me, she will give you a concern, something in the public she want to do, or something in her activities she want to do, or something in her hobbies she want to do, or she's worried about something like the previous scenario. I'm worried my grandmother died. And don't forget, as I wrote in the chat box, two complication or four complication very common. You have to mention with any procedure.
Yes, I mentioned
Yes,
it.
yes, I'm repeating for others. So two
Yeah.
eyes, which is infection injury, two P's, pain and
Bleeding.
bleeding. Yes,
Bleeding.
bleeding
Bleeding.
and yes, and pain. Here, it's very important to mention pneumothorax because it's very near to the pleura, and I think you didn't, you just skip. You said something else, bleeding and pain. I think try to give the most common, but always reassure after giving the shot.
Mm.
Reassure her that or him or her that it will be done by expert hands, and never have this complication, or very few percentage we had this complication. At the end, the social, the support, and even the monitoring. And at the end, if you can offer her someone to drive her home after, she will be fine. Okay?
Okay. Nice.
Any other question, Dr. Sarah?
No, clear. Clear now.
Clear. Okay. Dr. Ayula, anything you want to add?
No, thank you.
Uh, any other comment from others?
I
Any
think Dr.
idea?
Bassem, the
Mm.
Hickman line, in upper chest, so she can mention in your under your collarbone, because the patient mentions that how I'll go away or meeting the people with some tube in my neck,
Yeah,
and
yeah,
it
she
is not
said.
in the neck. Yes,
Yeah, she
usually it
said.
is not in the neck. It is in upper chest. So this is very assure the patient. It will be, yes, we will
Yes,
access through the neck
exactly.
vessels, but that is a small tube that will appear to, and we will access through
أيوه.
it your medication. It will
دكتورة
be
فاطمة
in
سلام كيف
below your collarbone. So
Exactly,
it
yes.
will be under the clothes.
Yes,
So
yes,
don't
you're right.
worry about that. Yes.
Yeah, good comment. I think Dr. Sarah, in between, she mentioned that the part will be appearing in the chest, but we will access through the neck. But she didn't make it clear for her. That's why the patient was worried about the appearance. But
Yes.
she explained it. Yeah, but
Yes.
please,
Yes.
yeah, stress on it. The part will be appeared. It will be in the chest, not in the neck, because he
Yes.
gave you the question how I will go out with this channel with this catheter or with this line in my neck.
Mm-hmm.
So again, clarify it for her or for him. No, it will not be appeared in your neck. The part appeared will be in the chest, and
Yes.
you can cover it by dressing and the clothes above. Okay.
Hi,
Clear.
hello.
Yeah, Dr.
Hi,
Maida, how are
hi.
you?
I'm fine, thank you. Very nice, Dr. Sarah. It's really nice. The only thing that just I want to remind you that to signpost whatever you are, when you are talking to any patient for like this procedure or anything else, you signpost like uh,
Yes.
you first explained already the tube it looks like and everything. Then check her understand do you want up to here? Do you want to ask any question? Are you okay? Then we continue. Now we are. I will tell you about the bad effect, like, and the good effect of this procedure. So yeah, it will be clear to follow, and at the same time, you show the examiner that you are taking the procedure one by one. So the signposting is very important. If you add it to your conversation, it will be more clear, and it also let the audience
Pay
understand
attention.
from where you are
Yeah.
starting and where you are ending.
Yeah. You want to pay attention to the surrogate that I am going in this part. Are you following me here? Are you following me? Did you understand this part? Then I will move to the next part like this. Yes. It's a good way, Dr. Maida. Thank you. Yes, it's nice to ask in between and try to make it as pieces, as Dr. Maida mentioned, in order to have his attention. Yes. Yes,
Yes,
Dr. Maida,
thank you.
continue.
Nice comment.
Yeah. Any other comment, Dr.
And
Maida?
also just draw your attention for just I think I write it here.
Yeah.
Okay, just to I just
Any
forget it.
comments?
I just forget. I put it in the comments. I
Yeah,
just
yeah, the
I
confidence.
forget
I
it.
agree. I agree about the confidence. Dr. Sarah today looks more
Tablet.
confident. Yeah, I think
I put.
Thank
she
you. Thank
was,
you.
yeah, she was talking in a very confident way today, and she's acting today like very confident.
Yes, regarding the options, this is the other thing that when she asks you if there is any other options,
Hmm.
as Dr. Bassem said, first you explain why she didn't want the procedure. And after you understand that, and if she still insists that you don't need the procedure, and she asks if there is any other option, your duty to tell her about the other options. You don't need to, you tell her the other options and why we prefer this option over this one. Like
Yes.
the cannula is still an option, but the bad effect of this cannula that you have a lot of breaking in your skin. The chemo is, and we need a lot of medication to go through and to take a lot of bloods, and this will be very painful and whatever. Whatever you want to convince, but you still need to give her the options, and this is and it is not your job to let her to your job is to make things clear for her, and then she decide which to take. So the convention of the patient that by make things clear for them, and they have the right to choose, even if they choose the wrong side. It's not our job. Our job just explanation and clear explanation.
Yeah, Dr. Maida, for somehow I agree, but if you explain some other procedure or alternative, and the patient will go with the alternative, I think you might lose the case or the station. Why? Because the task is to talk about Hickman. If you went out of this station and the patient is agreed to do another line or another procedure, so
No,
I think,
the concern, the patient have a concern. If there is, she asked her clearly that if there is any options. So this is our duty to say yes. There is an
yeah,
option,
there is,
but
but
it is not that good. You tell
exactly,
the patient, you tell there is options, but why we are not prefer that one.
yes. So the
The
best
only thing that,
interest,
yeah,
yeah,
but in the best of interest, that's to go
exactly,
for the Hackman.
exactly.
Uh, I really want to just to clarify this point that it's important. It's important don't to take everything in over your shoulder. Your duty is to explain and make things clear, and the duty of choosing is the rights of the patient. So when we say like convince the patient, it's not, you don't push hard. You just need to explain clear. This is your job. Explain clear. If you explain clear, most probably the patient will go in your side. But it is not your job to convince him hard. Like, no, if you, I think you did this part is not in a good convincing way. Like, you will have this and you will have this. No, this is not the right way.
Exactly. Yes, exactly. But again, as two choices, you are not here to give her two choices. You are here to give her one choice according to the of course the task. If the task is talking about Hickman, so you will go out from this station. I explained well and the details of the Hickman, the procedure, the advantage, disadvantage. At the end, the patient is not agreed, but I give her when she asked me. By the way, when only she ask you about alternative, don't offer her or don't be volunteer to tell her there is another option. If she is not agreed, try to convince, to find out why she doesn't agree. And if she insists and she asks you, doctor, I want another alternative, now you the time to give her the alternative and to give the comparison between both of them, which is the best interest of your condition, our procedure today. Don't give any advantage of the second option, and don't go out from the station with the patient agreed for the alternative, because this is against the task. Try to show that the first and the best interest of your condition is our procedure today. There is multiple options. However, the best interest is our procedure. There is other risk for others. We can sit with you again. We can explain again. We can arrange a meeting with the consultant, and we can do everything for you. Yes, you have the right to choose, but in the best interest, this is the task. We have to explain the task. Okay. So and somehow I agree, but don't give her the options. So what you choose today, Hickman or tunneled catheter? If you say that, you will fail the station. You are here to explain the task, not to give her an option, unless it was written in the task. Give her the possible option one, two, three. If there
Yes,
is
that's
options,
the scenario.
yeah, if there is two options or three options, for example, some scenarios like big tube and rig tube, and try to convince and give her the options. This is the time to give her the option to choose. Whatever she choose, you will go with her. But if they mention to you, no, do this, so you will explain this, do that, you will explain that, and don't give her the option to choose.
And
I hope
in
it's
exam scenario, Dr. Bassem, they
Mhm.
said like that because they need to from you to explore why, not to
Exactly, not only to convince.
yes,
Yes,
and to be honest, yes, there is other option, but this is the best for you.
exactly.
Can
Yes.
you let me know why you
Mhm.
not thinking about this, and say why many times if she still
Yes.
worry about. So if you explore why, you can solve these issues. Usually in the exam, they will not going for a conflict and let you away from your scenario.
Mhm.
Usually. In the real
Yes.
life, yes, but in the exam, they need from
Exactly.
you
Yes.
this just to explore from the patient, to be good listener and to explore her fears,
Yes.
to yes, and to provide solutions about why she refusing. Yeah.
Yes, I agree. So let the patient express what he feel inside. Whatever he expressed to you, try to solve it, try to address it, and to give him the solution for it, and follow the task at the end. Thank you, Dr. Aisha and Dr. Maida. Any comment from others? Any question?
Hello, Dr. Basim.
Yes. Hello.
Just a simple point, like if you explain the Hickman line very well,
Yeah.
meaning you don't need to discuss any other option. I think that will be enough. Like the
Yes.
like Hickman is the line that will put in the upper part of your chest, so that it is the best option, so that we don't need to put it anywhere else, so that we can prevent to break you every time and then
Yes.
like this.
Absolutely right.
So you close the other option from the early, from the beginning.
Yes, I agree. Absolutely right, doctor. But sometimes some surrogate, he will insist to hear about other option and he will give you or he will test you. This is by instruction by examiner. He want you he want to examine if you will be strict to the scenario or the task, or you will go away from the task.
You
Be
you should
sure
have.
this is a test. Yes, I know. Definitely it will be test for you. If you will deviate from the task, they will fail you. For example, yes,
They,
we have another option.
they can put
Yes,
it
doctor,
like that.
give me the option. If you start to explain the option, you will fail the station. Okay?
That's why I said from the beginning, full
Yes,
explanation, clear explanation, so that you already, the examiner that's there, he can know well that you close the other options already from the beginning. If the
exactly.
surrogate read it later, so that you can just remind him, we did this option because it is the best interest of you. The other options maybe not fit you. Uh, the Hickman line will prevent this from doing this again and again and again. It will done once until you finish your course of treatment of medication. So better option that is, we cannot remove. We don't need to remove it every time. We don't need to put it again, unless risk of
Infection or something happen.
we need a large bloodline. So this is the best from the beginning. We make it clear like this.
Yes, yes. But again, you can do it straight away, but some surrogate will be instructed to give you a test. Please,
Ah,
doctor, give me an option. If you follow this option and this concern, you will be failed. Yes, there is option, but this is our best interest of your condition, and stick to the task. Don't deviate. If there is
yeah,
in
yeah.
the option, there is in the task other option, okay, proceed and go ahead. But if not, this is your scenario, this is your task, stick to the scenario and task.
Probably they
Absolutely
will
right.
not make it multitasking. It will be more.
Yeah, definitely it will be one task because you will explain, you will draw, you will say the complication, the
Yes.
consent, the social, the support, and the monitoring, the closing of the. I don't think
Uh,
they will give you a lot of options. But I
yes.
think Dr. Maida talk about it as practice or as in real practice. Yes, we are giving
Mhm.
the options, and the patient at the end will choose the best interest of him. But in the paces wise, the exam, they want to know if you can convince or no, you can address the concerns or no, you can give a solutions or no. This is
Yes.
the paces exam, really.
Mm. Yes. And procedure pre, during, and after, right?
Exactly.
So
Yes.
that you reassure the patients that there is preoperative measurements,
Preparation.
there is
Yes.
operative measurements, postoperative measurements. So that operation, that the procedures will be clear.
Yes, agree 100%.
Mm.
Thank you, Dr. Ahmed, Abu Ahmed.
Okay.
Okay. Any other comments? Really, I like the way Dr. Ahmed comment. Anyone want to comment just to express or to gain more confidence? Please share with us. Don't be only listener. It's open discussion. Okay, so all satisfied. Procedure, one of the common basis scenarios. Please remember always to use the pencil and the paper. Whenever a procedure outside, be ready to draw even two lines and something coming or some other tube or whatever. Be ready to draw whenever you have a procedure scenario. Dr. Sar, the last comment, blood channel. Don't say blood vessel. It's a jargon.
Mm-hmm.
Okay? Blood channel. So
Okay.
a tube or a canal or catheter, no, not catheter, line, even line difficult. So the tube, the best tube
Yes,
will be
you. Yeah.
inserted, yeah, inside a major blood channel in your neck and to be accessed through your chest. Simply and easy. Okay.
About the care here, Dr. Bassem, please.
Mm-hmm.
I heard this is no swimming and no
Yes.
bathtub. Any other precaution like contact sports or avoiding
I
injury of this
I I
place?
think I think Dr. Aisha, good question by the way. It's not only the procedure or the catheter, it would be also for the chemotherapy. This patient should be away from the crowded areas, right? Because he will be immunocompromised. So it will
But
not
I
be
mean
only
the precaution of the Hickman line itself,
okay.
the care of it.
So the
If Dr.
water,
Ariola has any
I
other,
think no, the
yeah.
water and the heat. I think this is the most dangerous risk for
Mm-hmm.
the catheter. The heat and the
And it
water.
remaining for months or many
Yes,
or
yes,
year or
months,
like
yes.
that, huh?
No, maximum, I
Yes.
think 1 year.
Mhm. Okay.
Dr. Ayula, you
I
have
think
any?
more than this.
Yeah, so I will
Yeah.
ask Dr. Ayula if she has any other
Yeah,
precaution.
I think for the contact spot, yeah, the contact spot is to be avoided. I was just going through King's College counseling leaflet about Hickman line, and it says that contact spot should be avoided.
Mhm.
Just their routine walk, they can go on their walk, they can go to the gym, but not involving lifting heavy things.
Yeah,
Avoid contact sports, then avoid
yes,
swimming, bathing, shower is okay
yeah.
for them. And there's one thing you asked the last question. I can't it's totally skipped my mind. There were two things you asked about when it should be removed. I think it's as long as the patient is having treatment.
Yeah, yeah.
Yeah,
And
once
no infection.
no infection, yes, no
Exactly.
infection. Yeah.
Yes. So as long the patient is receiving, as well as he is it's clean and no infection. Okay. Any other comment, Dr. Ayula?
No.
Dr. Aisha? Yes,
No,
contact
thank
sport, I
you.
agree, yes.
Thank you.
And the lifting heavy object as well. The same as for pacemaker. It might be displaced or it might be bleeding through it. Okay. Yes, it's a nice discussion today about the procedure. It was a very nice session by Dr. Ayula and Dr. Sarah. Well performance as usual. Good comments also from others audience. Thank you for attendance. Any comment
Thank you,
before?
Dr. Lee.
Yeah, most welcome. Any comment or question before ending the session?
Mm.
Okay. See you tomorrow, inshallah, with the short clinical day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you, everyone.
Okay.